Hi, it's Manika, and thank you so much for tuning into my channel. As some of you may or may not know, the month of May is Mental Health Awareness Month, and I'm a licensed social worker. So today we're going to be talking about mental health and what you can expect at your first counseling session. So if you're interested in this topic, then please keep watching. The reasons why people might choose to attend therapy can be varied. They can be many. It could be because someone is experiencing some difficulty in their life. They feel stuck in their life and they don't know how to move forward. They might have recently experienced a loss of a spouse, a child, a divorce. They might be experiencing some anxiety and some ongoing depression. So it can be varied in many. So people might choose to do their own research online and find a therapist in their area, or they might be mandated to go. A family member might suggest that you go, a court system might mandate or suggest that you go. So the emotions that you bring into that initial session are going to be very real. And a lot of therapists, we understand that you're coming to the first session with a lot of these apprehensions. And we've been trained to be able to try to pull information out of you if you are feeling a little apprehensive about talking with us, because we're going to be asking a lot of personal information and asking that you share things that you might not have shared with anyone else before. Um, so we understand that, and we really try to be understanding and empathetic. If you are angry for having to be there, if you're feeling nervous, if you're anxious, if you don't know what to expect. So hopefully the tips in this video will really be helpful for you. So I like to tell people, when you schedule your first session, it's just like scheduling a session with your family doctor or your dentist. Um, so you'll contact the office, and you can choose to either contact someone who works in private practice or someone who works in a community mental health agency. So I'm going to talk a little bit about the differences between the two. But initially, you're just going to call to set up an appointment. If you're under 18, then your family member will call and set up the initial appointment that works for you and your schedule. Then you'll be required to bring some form of ID as well as your insurance card if you're going to be paying through insurance. And we'll talk about payment stuff a little bit later. So when you come to the first initial assessment, we ask that you give about an hour of your time to allot for us to be able to gather the information. And this is what we call our intake session. So during the intake session, we're just gathering general information about what brought you to our office. So we're going to be getting information such as your name, your address, if you're a student, if you work full time or part time, if you're having any difficulties on your job, um, how many people reside in your household, just general things that gives us a picture of what might be going on. We're going to be asking about the quality of the relationships between you and the people in your life, you and the people in your life. If you do anything of interest, we're going to be asking you what you think your strengths are. We're also going to be asking you if you're having any difficulty on your job, if you have any cultural or religious concerns. And those are the times for the clients that I see that they really talk about any racism that they're experiencing, or microaggressions, or difficulties on their job with promotions and things of that sort. So that'll be your opportunity to let us know about that. And then we're going to ask some questions about your mood, your behaviors, and your functioning. So we're going to be asking you, have you had any feelings of depression? And then we're also going to be asking you very specific questions such as, well, when did the depression start for you? Was it in your teenage years? Were you an adult? Um, and how intense is it? How frequent do you experience that depression? And how does that present in your life? Do you get so depressed that you just want to stay in the bed? Are you having crying spells? So we'll try to really delve into the symptoms of what you're saying that you're experiencing. So again, we're going to ask you about depression. We're going to ask you if you um, have any changes in your appetite, such as you're overeating or undereating, if you're binging in terms of your eating, if you're experiencing any anxiety, any worry or fear, if you've had any recent losses of family members, so if there are any bereavement issues. We're going to be asking you if you have feelings of anger and aggression towards others. We really specifically hone in on that for children, if they've harmed any animals, if they're aggressive with their peers. So we ask those questions. Another one that we would ask for children is, are they having incidents where they're wetting the bed? We also ask about nightmares and night terrors, whether or not you're experiencing those. We'll also ask if you've experienced any recent trauma in your life. And then we'll ask, do you hear things that other people don't hear, or do you see things that other people don't see? And then the personal questions we'll ask you is, have you had any experiences of physical, sexual, or emotional abuse? And those are those really personal questions that you may or may not feel comfortable answering. And if you don't, we understand. You can choose to disclose that information with us or not. We'll also delve into your family history a little bit and asking you, has anyone in your family ever been diagnosed with a mental disorder? Has your mom ever experienced depression, anxiety, worrying, kind of obsessive compulsive concerns, any anger and aggression? So we'll ask about that and ask you to expound on that a little bit. Um, and then we'll also ask if you are currently using any drugs or alcohol. So we're trying to really get a picture of how are you coping with the things that you're experiencing in your life. And this is where it differs between the private practice and the community-based mental health agency. So in the community-based mental health agency, a lot of times they're asking and gathering all that information because in that setting, they have to be able to come to a diagnosis that they're going to give you. And in order for you to um, be seen at a community based mental health agency, a lot of the times the diagnosis is the way in which the community based agency receives reimbursement. It's the way that they're paid. They bill your insurance for the services, and they can only bill your insurance if you have a diagnosable disorder from the DSM. So if you go to a community-based mental health agency and you're using your insurance, there is a diagnosis that has to be tied to all of the things that you're presenting with in the session. They gather all that information. So it is based off of self-report. And then from that, a diagnosis is generated, and that's how your insurance is billed. On the private practice side, you have to pay out of pocket. It could be a little bit more expensive, but they'll still ask you the same questions. But when you go, you'll pay cash, credit card, you'll pay out of pocket, and your insurance won't be billed. But 9 times out of 10, they will still diagnose you with a disorder just based off of the things that you're presenting with when they do their assessment of the things that are causing you difficulty in your life. So again, we ask that you allot about an hour for that. Try to be as upfront and as honest as possible. Share as much as you feel comfortable sharing. And that's pretty much what happens in the first session. We really, again, don't delve into the kind of the meat of the things that brought you there. When you get to your second and third session, that is really when we start getting into um, more of the symptoms of what you're experiencing, asking a little bit more questions that aren't as general, that are a little bit more specific. But first, again, we're trying to get that general information. And then after you've had your initial assessment, then will schedule time for you to continue to come back. So it could be weekly that we want to see you, and it could depend upon the severity of the symptoms that you describe to us. It could depend upon how often you're mandated by the court to attend. So a lot of those things factor in. And then you'll continue with the ongoing sessions, and then it's in those sessions that we're really beginning to do the work to help you recover from the things that you're struggling with. So we will create something called a treatment plan with you. And basically all a treatment plan is just the goals that we agree to work on once we're building our therapeutic relationship. So off of the information that you tell us, we'll together create goals of things that we think would be good for you to work on when you're in the therapy session. So it's not like we're just coming in and talking and really don't have a plan in place. We're using therapeutic interventions that have been clinically shown to help you with the difficulties that you're struggling with. And then we create a plan for you to get to the other side of that difficulty and to begin to improve the functioning of your life. So that is pretty much what happens in the session. If you have any questions about that or if you need further clarification, please feel free to reach out to us. We're going to be making a lot more mental health videos for the month of May. So if you think someone could benefit from this information, if they've been kind of on the fence on whether or not they should contact a mental health provider, please share this information with them. If you like the information that I presented today, please feel free to subscribe to my channel. Again, we'll be doing more videos and uploading more here. Um, and if again you have any questions, please put those in the comment section and I'll be sure to address those in other videos. Thank you so much for watching.